From the Toronto Star, I'm Saba Eitizaz, and this matters. They were in a mental crisis. Their families called for help, and they ended up dead. 62-year-old Ijaz Chaudhry, father of four and suffering from schizophrenia, was shot by the police in his own home after his family called a non-emergency line seeking help. His death is just the latest. He was the third Canadian in crisis to be killed by the police just in the past month. All three were either Indigenous, Black, or people of color. Many think something seems to be going very wrong here.
They were yelling commands in English. He doesn't speak English. You have an interpreter right there. He said 0 words. And while they were banging the door, the ETF officers came from the back, scaled the windows from the back, and shot him.
Shrinking budgets for mental health programs has led to the police becoming de facto frontline mental health workers. And experts are saying they might be on the wrong front line. Canada's largest psychiatric facility, CAMH, has thrown its weight behind mounting protests to remove police officers as first responders to mental health emergencies. It can seem counterintuitive. People experiencing a mental health crisis need medical help and mental health professionals. Why are they faced with guns and body armor instead? And what's being done to avoid these tragic outcomes, these deaths, and these devastated families left behind to deal with loss, rage, and unanswered questions?
No justice, no peace! Eradicate the police! No justice, no peace!
In today's episode of This Matters, I'm joined by former Toronto Mayor and coordinator of the Toronto Police Accountability Coalition, John Sewell, to find out why guns and body armor seems to be the first form of response to a so-called wellness check, and what needs to change in the backdrop of violent police actions and growing calls for a complete review of police functions and finances. Thank you so much, John, for joining me today on the podcast.
Thank you.
I want to start with this. When you're in a mental health crisis and you're faced with people with guns and body armor, what kind of effect can that have on people, particularly if they've had encounters with law enforcement in the past?
Well, apparently they get very, very upset and they either want to run away or they want to attack. That seems to be what happens. And that's where the problem starts.
And keeping that in mind, what is the logic of armed officers conducting these so-called wellness checks?
Well, the Toronto Police Service Board thinks that you never know what can happen in a call, so you better send somebody who's uniformed and armed. Our organization, the Toronto Police Accountability Coalition, has argued for 10 years that they should be using the Mobile Crisis Intervention Team, which consists of plainclothes officers, unarmed, and a mental health nurse, and that they should be the ones who deal with people who are in mental crisis. The police board and the service has consistently said, well, we think the armed officer should get situations under control first, and then we can call in the Mobile Crisis Intervention Team. And of course, the result has been a number of fatalities. It's been very discouraging dealing with the service and the board. They have been totally unwilling to move.
Right. And I know you've been advocating for this for a very long time. And researchers are also saying that over the past 2 decades, almost 70% of individuals killed by the police have had mental health issues or some kind of mental health crisis. And you've been talking about this. Why aren't qualified mental health professionals dealing with this situation instead of, or at least alongside the police? What's been the roadblock here?
I don't know. It might be a matter of money, because we've asked that the police in Toronto set up more than just the few mobile crisis intervention teams we have now, where they're only on 5 days a week and they're only until 11 o'clock at night. And while they've always said hospitals really can't afford to put the mental health worker into that. So that seems to be the issue there.
And I do want to speak about the money a little bit. According to a 2018 CAMH report, Canada spent about 7.3% of its healthcare budget in mental health. If you look at countries like the UK, they spent double that, while police budgets continue to grow. And we also don't have enough mental health services for racialized communities, particularly, and we see the police sort of ending up filling the gaps of these essential services. Is that an important conversation we need to be having right now to be resolving this problem?
Oh, very much so. Very much so. You must remember, we seem to be a society that says the more police we have and the more things police are doing, the safer society we're going to be. Totally fallacious, but nevertheless, it's what the police say, and it's what a lot of people believe. I think the events of the last few weeks have started to shift that, and people are now beginning to say there's got to be better ways of dealing with these situations. And part of it will be reallocating money from the police to community-based services that can deal with people who are in mental crisis, and maybe starting to spend more on social services.
Meanwhile, keeping these recent terrible killings that we've seen in mind, while the status quo is there, it raises an important question that have police become de facto mental health workers in this day and age? Why are armed officers being sent in to answer mental health calls? And right now, if they are, do they actually receive any mental health response training at all? What has been your experience?
Well, I've explained why they're sent in as first responders, armed officers as then a first responder. I think they receive some training in de-escalation. But as I say, trying to train a lion to act like a mouse is not a very smart thing to try to do. You aren't going to get anywhere. That's what they seem to be doing. Oh, yeah, well, we've trained them to do these things and take control of situations. Oh, but now we're going to train them to back off. Well, I think what happens in the situation, the basic training takes over and they don't back off. They don't de-escalate.
And what's the basic training here? Because it doesn't seem like it's to de-escalate, it's to use force.
Well, they're told to de-escalate. And so they spend some time talking about that and talking about people who are mentally ill and so forth. But, it's a bunch of hours added on to everything else. And given the culture of policing, which is to be big and strong and go in and control situations and support your buddies, I think the de-escalation just fades into the background.
And I remember I saw an interview that you did a while back, and you spoke about there already being such a unit that the Toronto Police has within its force, a mobile crisis intervention team. Is that still there? And are they qualified to deal with these situations? And why are they not called as the first responders?
They've had a mobile crisis intervention team for the last 15 years. But as I say, the police board and the service have made the decision that they are never first responders. There'll always be armed uniformed officers who respond first to get the situation under control. So that's the problem. It's a straightforward policy decision. To me, the interesting thing is Toronto City Council has decided that, in fact, we're going to have non-police organizations that are first responders in cases where there's a mental crisis. Good on City Council. It's crazy that the Police Services Board could never reach that decision on its own for the last decade.
And I know you've been working on this for the last decade, and you spoke about the obstacles there, money being one of them, and then just this policy that's been implemented, that this is how a crisis will be responded to. But you've been met with resistance pretty much at every turn. Why exactly, other than these reasons?
Well, you've got to remember that the police service is a very, very hard nut to crack. It thinks it knows what it's doing. It thinks it's there to protect us from danger. And it's not very willing to change. It'll change when it wants and how it wants, but it does not like people coming in and saying, by the way, we think you could do this a better way. There's a lot of reasons why people don't speak out, and the police they think they're in control and they aren't willing to listen to advice from anyone else. Hopefully that is changing, but it's a very, very strong culture. As we know, it's hard to change cultures.
So what exactly would qualified mental health professionals be able to provide on the scene of an unfolding emergency that might be clearly missing at the moment that's leading to this tragic loss of life?
They're going to be able to talk people down. That's their life. They know how to do that. You must remember that social workers and child protection workers, they're doing this every day, where they're going to situations that you and I might consider dangerous, but they go in, they talk people down and get people to relax and make some agreements. So that's what's going to happen. And the experience in other countries, in both the United Kingdom and out in Oregon, is that these kinds of non-police interventions work exceedingly well.
At least 5 people have died during these kinds of mental health calls or wellness checks by the police since April. All 5 were Black, Indigenous, or people of color. Does systemic racism compound these kind of crisis interactions? How do we acknowledge and address that?
The racism is systemic because it just goes on and on and on. It's part of the system. I've had some experience with this. When I was mayor in 1979, the police in Toronto followed a Black man, Albert Johnson, who was mentally ill, into his home. They knew he was mentally ill, shot him to death in front of his children. I spoke out at that time. That's 1979, 41 years ago, and said, this has got to change. We've got to have policies where this does not happen again. Here we are, 41 years later, same stuff. So I think you could say it's systemic because it's just part of the system, and the police think not much you can do about it. This is the way things are. That's what it means by systemic racism.
And I want to delve further into this. If systemic racism, discrimination, and unconscious bias plays a deep role in police culture, as you're speaking to, doesn't it also inform how police respond to the person they've been called to help, how much danger they feel they're in, and what level of force they're going to take? They decide that going in.
No question about that. There's absolutely no question about it. And people are going to be more scared than usual. And I think that's one of the things we've been seeing in the last few weeks. A lot of Black people speaking out about how they're terrified of the police. And even the chief of police of Toronto, Mark Saunders, who's Black, says he goes into a store when he's in plain clothes and is followed. So there's no question that those who are in mental crisis are going to be very, very disturbed when it's the police at the door.
And what can be done to address that other than just changes to who will be the first responders at the front lines? How do we address this much deeper issue that you're saying you haven't seen much change of in the past 41 years?
Well, in terms of the systemic racism in the police, we have to disrupt police culture. We have to make a real change there so that we're trying to get police to behave in fundamentally different ways, which means you have to really break down the organization, reorient it, bring in some outside people, and so forth. I think it starts by the way we recruit police officers. Police officers are recruited at the very bottom, and then they work their way up through the organization. So anybody who gets to be appointed to a more senior management position has been in the police force for some time and has picked up the culture about what you can do and what you can't do. The new interim chief that they're appointing in Toronto has been with the Toronto Police Force 40 years. Well, guess what? He sure got that culture right in him. And one of the things about cultures is that when you try and act differently or ask questions, you get ostracized. So the people who, in fact, might bring change to the police service usually get kicked out or decide that they're going to leave because they're disrupting. So we've got to change that way of recruiting people and then how they get appointed as managers. In terms of recruitment, we should be doing what every other big organization in Canada does: post a job description and ask for candidates to fill the job description. That's what we should be doing. And so if it's a middle management person, you want to hire someone who meets the qualifications of a middle manager. You don't want to just say, oh, we're appointing somebody from below. And I think the second big change, the first is in recruitment. The second is in terms of managers. We've got to appoint managers from the outside. One of the things that I think every one of us knows is that having a good manager is almost the best thing you can find as an employee, because good managers make you feel good at work, and they allow you to take chances and do innovations and those kinds of things. We need some of those managers in the Toronto Police Service. And I think the senior managers we should be hiring from outside police. So they'd be two really big changes in terms of police culture.
How do you see the role of the SIU in investigations? Do you see it as problematic once these tragic events have occurred, as the organization itself has pointed out, that officers at the center of cases involving serious injury or death of civilians cannot actually be compelled to turn over their notes or participate in interviews with the SIU, and the SIU is comprised of former cops. How do you see this role in the current situation?
Well, I don't think the SIU is a very useful organization. They're only allowed to do one thing, and that's to see whether or not there was a criminal act carried out by the police officers. They are not permitted to say, the cop really acted unreasonably here. We got to change things so this doesn't happen. They're allowed to say that. And of course, that's what's needed. I mean, I just think of the one example that the SIU was involved in, where a police car ran over a couple of teenagers in a park at night. Some teenagers were having fun in a park, and the police decided to go in without the lights on in their car and drive around to see what was going on. Well, it ran over two girls. The girls were, one of them had broken pelvis and so forth. The SIU was called in, did investigation. No, they said no criminal offense. Okay, that's it. When you think, why didn't they say, this is really stupid? These officers are really, really dumb. But the SIU is not allowed to say that. So I don't see the SIU as being a particularly useful organization. And I think what we have to do is stop trying to allocate blame after bad events. We have to try and figure out how you prevent the bad events from happening. We need an organization that wants to do that, but we don't. Because what happens when the SIU says there's no criminal events, the police then say, okay, let's just carry on. And they just carry on.
So CAMH, Canada's largest mental health hospital, calling for the removal of the police when it comes to the front lines, when it comes to dealing with people in mental health crises. What does that signify right now that they're coming out with this statement?
Well, I think that's absolutely terrific that CAMH comes out and says, we've got to change the practice. I wish they'd said it before, but nevertheless, they've said it now. And I think that opens up the opportunity of trying to get more community services to have a rapid response for people who are in mental crisis. And CAMH should be part of that, but they shouldn't be the only part, because some of the people who are in mental crisis have had experiences with big institutions like CAMH and aren't happy. You have to bring in some of the other organizations that deal with this issue, like the Gerstein Center and so forth.
So what is that new way forward in your view? You're talking about the involvement of CAMH, other organizations sort of working alongside with the police to deal with the situations. What do you think would be the best route?
Well, what Toronto City Council has said is that the city should be actually pulling together the partners to set up a service where it's non-police intervention. So in setting up the service, you might involve the police in doing that, but the big thing is to bring in those mental health services to get them working together and get them well funded and figure out what number people phone when they need that service. And then we get the police entirely out of it. And obviously what happens if the mental health workers get into a situation where, there they are with the person and it's getting out of control, well, then they can phone in the police. But not until that happens.
Thank you so much. That was very insightful, John. Thank you for talking to me.
Thank you. Yeah. Bye-bye.
That was John Sewell, former mayor of Toronto and a member of Toronto Police Accountability Coalition. That's it for today. Thanks so much for listening. This Matters is hosted and produced by me, Saba Eitizaz, Adrian Chung, and Raju Mudhar. Produced and mixed by Sean Pattenden, and our director of programming is JP Fozo. Our show theme music is by So-Called, and our episode music is by Mike DeAngelis. We want to hear what stories matter to you. Please send us comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.